We take for granted that the bladder will just work on its own and the kidneys will do its job. But when you get a spinal cord injury, it doesn't fill as well, it doesn't drain as well. You can get something like hydronephrosis, where the urine can back up into the kidneys and damage the kidneys. I wish I knew all the changes that would go along with it in terms of the intermittent catheters, spasms, and everything else affecting the bladder. But these things come over time, and everybody's different.
Bladder management changes as people age. There can be more issues with technique in people's mobility, hand function, weakness for a various amount of reasons. People with aging will get arthritis just like anybody does. Their hand function might have changed. Some people will not lubricate their catheters, and that can cause some damage to the urethra, little micro tears where bugs love to live. As men age, quite often their prostate can enlarge, and that can cause a problem with doing catheters. Or if they're doing in and out catheters, there may be an obstruction. For women, when they go through menopause and they get a dip in their estrogen, some people can get more urinary tract infections during those times.
I haven't had any issues with my bladder up until 2017. I had a really difficult situation, and that created a problem of incontinence. I would have been 61. I had gone through menopause, which rose a couple issues around my bladder function. It kind of took me for a loop because it caused a chronic UTI. My doctor recognized the tendency of urinary health to change with menopause. She made some adjustments around that.
I was injured 36 years ago. I was getting these intermittent catheters. Things were going well. And the problem with this time now, my spasms were getting worse. Nothing was working for the spasms. The worse the spasms got, the worse the bladder function got. So I had trouble getting the catheter in and draining properly. The intermittent catheter became a pain. Had to do it 5 times a day. I'm a professor at university, so during teaching or meetings, had to plan when to do the catheterizations to fit into my meetings, fit into my teaching. So we decided to go with an indwelling catheter, so I didn't have to do catheterizations all the time.
People with spinal cord injuries should take a look at their bladder management when things they're doing aren't really working for them. If you're spending hours and hours a day on managing your bladder, there's got to sometimes be a better way or a different way.
Since I started the indwelling, it's made life much easier. I can just do things normally and function. We keep an eye on the bladder. We don't irritate it. There's no cancer in there, and it's clean. I think that's the main thing.
I'm pretty good now. I go for quite a while without anything, but I really have to manage it.
Sometimes the smallest little change can make a difference. There's options for management, and there's things that people can explore. Having conversations with the urologist so that they can work as a team on what would work for them. So whatever type of bladder management you're using, at the end of the day, we want the kidneys to stay healthy.
Knowing more about your bladder, how to keep it healthy in terms of your catheterizations, drinking properly, keeping the urinary tract infections low, not overly abusing antibiotics, talking to your urologist, getting your yearly cystoscopy, urodynamics done. These things can keep your bladder healthy and keep you healthy. You can have a little healthier life in terms of quality of life too.
I'm 66 and I really have a good 10 years left of probably active lifestyle. I like to sail and kayak and travel, and my urinary health has to be really on top for that.